How dangerous is hyperglycemia? Diabetics have to worry so much about preventing their blood sugar levels from dropping too low, called hypoglycemia, that they often forget how dangerous it is for levels to become too elevated, called hyperglycemia. Although this condition doesn't apply nearly as often as hypoglycemia, it can still turn into a dangerous situation. It's important to know the warning signs associated with hyperglycemia. When an individual has too much glucose in their blood, some of the symptoms that they will experience include excessive thirst, resulting in a dry mouth and blurry vision. The individual will also feel overly tired, almost to the point of exhaustion. Anytime a diabetic feels these symptoms, they should immediately check their glucose levels. If an individual fails to acknowledge these signs, their condition could land them in the hospital or, in worst-case scenario, a coma. When you received your initial diabetes diagnosis, you should have been instructed on how to deal with low and high blood sugar events. But if you're experiencing hyperglycemia too often, it's a warning that something's not right. The main culprit is usually tied to poor eating habits, although there are other steps that you can also take to minimize the occurrence of high levels. You will probably want to start a detailed food journal for a couple of days to verify what you're consuming. Often as a diabetic becomes accustomed to their condition, they begin to ignore dieting advice. The quality of their meals begins to suffer, resulting in poor eating habits. Another problem is the individual is not exercising enough. This is crucial to burn off excess sugar. However, if our levels are too high, say 300 milligrams, you should refrain from exercising. This is potentially a dangerous situation. Instead, contact your doctor immediately. One of the most important improvements that you can make is to increase your water intake and decrease other drinks. Tea and coffee are known diuretics. Juices, even natural fruit ones, contain sugar. You might want to lower your intake of other liquids and replace it with plenty of healthy water. The added water will help you flush excess sugar out of your system. It's also possible that some of the problem could be your medication. As time passes, it's common that some medications need to be adjusted to adapt to changes that your body is going through, both good ones and bad ones. Your doctor will be able to advise you when the time comes to change your dosage. Remember to never try to adjust your medication without your doctor's approval. Make sure to download your free report called Discover How to Be Healthier and Live Longer in Spite of Having Type 2 Diabetes. You can download this free report at the link below.